Good evening. How are you?
I'm good.
My name is Daisy. I'll be your nurse for today. Okay, your name is Amy. Last name?
Gonzalez.
Date of birth?
December 20th.
And any unknown allergies?
No.
Okay, let me go ahead and wash my hands. I'm washing my hands. Can I check your wristband? Amy Gonzalez. 12/20/07. Okay, great. Wash my hands again. Okay, so I checked her 2 patient IDs. I'm gonna go ahead and start with her skin. Can you please take a seat? Sit down here at the edge of the bed, please. All right, so I'm checking for uniform color. Her color is appropriate to her ethnicity, which is white. There's no lesions, there's no bruising. Patient is warm to touch. Flip your arms over. Checking for tenting. Make sure she's not dehydrated, so there's no tenting. Okay. Skin matches ethnicity. We're gonna check your fingernails. Okay, they're pink. No lesions noted. I'm gonna go ahead and have you put your hands together like this. Put your nails together. We're checking for clubbing. Patient has no clubbing. I'm gonna check her capillary refills. So they're 2+. And they're returning back to pink color. No cyanosis noted. Okay, I'm gonna go ahead and check your head. Can you sit up straight? Okay, so her head is appropriate for her body. I don't notice any lesions, any masses, any abnormalities. Do you feel any tenderness or pain?
No.
No lesions, no masses, no scars. She does have a little bit of acne on her face. I don't notice anything else. I'm gonna go ahead and, there's no indentations and no evidence of pediculosis. I'm gonna go ahead and check her TMJ. Can you open up your mouth and close it? Okay, so there's no crepitus, so she's negative for TMJ. Can you open up your mouth and clench your teeth? Great. Okay, so her temporalis abducens muscle is equally and strong. Trigeminal cranial nerve 5 is intact. Can you close your eyes? Do you feel that? Okay, you can open up your eyes. So light touch noted, trigeminal cranial 5 is intact. I'm gonna have you smile now. Perfect. Can you raise your eyebrows at the same time and puff your cheeks? Great. So cranial nerve number 7, cranial nerve 7 facial is intact. Palpate sinuses. Okay, I'm gonna palpate your sinuses. Do you have any pain or tenderness?
No.
Okay, no swelling noted. Great. Okay, let's go ahead and do your eyes. Okay, so eyebrows are symmetrical. Eyebrows are symmetrical. Eyelids are intact. On the eyes, so the conjunctiva is pink. And moist, there's no excessive tearing and no lesions. Sclera is white, iris is round and symmetrical. All right, I'm gonna go ahead and check your eyes now. Pupils are constricted and dilated. Gonna have you go ahead and follow the pen. Perla is reactive to light. Cranial nerve number 3, oculomotor superior inferior oblique, and medial rectus are intact. Cranial nerve number 4 is also intact. Trochlear inferior oblique is intact, and cranial nerve number 6, abducens lateral rectus is intact. Okay, can I have you stand up? Okay, we're gonna go ahead and do a chart just to check your vision. With one hand, you're gonna cover your eye. We're supposed to do this 6 feet, but obviously I don't have 6 feet. When I point to a letter, can you just tell me what it is? Or a number?
2.
Mm-hmm.
8.
And the other right? Again?
6. 4.
Okay, so her vision is actually off. She is 2200. So I'll have to send her to an eye specialist. Okay, go ahead and take a seat. Alright, so I'm gonna go ahead and check your ears. I'll palpate for tenderness. Do you have any pain?
No.
Okay. Alright, I'm gonna go ahead and check with a ophthalmoscope. I don't actually have one, but I'm gonna go ahead and use my pen light for now. I would use an ophthalmoscope though, an otoscope. So I don't see any drainage, any lesions. Do you have any pain?
No.
No drainage, no lesions, small cerumen, but not too much. Okay. All right. I'm gonna have you cover one ear with your hand. I'm gonna whisper something, and I just need you to repeat it back to me. Okay?
1, 2, 3, 4.
Cover your other ear.
7 and 9.
Okay. Perfect. Okay. I'm gonna go ahead and palpate for your lymph nodes. Do you have any pain?
No.
Any tenderness? Okay. And then let me check your mandibular and submandibular. Any pain?
No.
Okay, so non-palpable and non-movable lymph nodes. Okay, can I have you look up and look down? So patient has full neck range of motion. All right. Can you pick up your arms and put them behind your back and behind your buttocks? So she has full range of motion in the shoulders. So put your arms in front of you and supine, pronation, extend, flex, and she has full range of motion in both hands. Alright, I'm gonna go ahead and place my hand on your cheek. When I do, I need you to push on your face on that side, okay? Push towards me. Okay. So she has. Alright, so cranial nerve number 2 is intact, and your shoulders are gonna do the same thing, okay? Push up, and then push down. Alright, so cranial nerve number 2 is intact. Alright, I'm gonna have you lay down with your legs that way. Alright, so for her thorax, we're gonna inspect first. And I'm gonna listen to her lung sounds and all quadrants. I'm gonna have you take a deep breath. And out. Take a deep breath. And out through your mouth. Take a deep breath. And out through your mouth. Take a deep breath. And out through your mouth. Okay. Can you take a seat? Turn with your legs this way towards me. Take a deep breath and out. 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 And last one, breath and out. Okay, perfect. So there's no adventitions, lung sounds, no crackles, no wheezing, clear lung sounds. Alright, I'm gonna go ahead and listen to her heart sounds now. So I remember it as all people eat too much. So aortic. Okay, so normal S1 and S2, no gallops. I did not hear an S3, no heart murmurs noted. Okay, go ahead and leave it down. I'm gonna inspect your abdomen, scoot over just a little bit. Okay, all right, so I'm looking at her abdomen. There's no distension nor abnormality noted. There's no lesions. There's no scarring. Obviously, she would have her shirt up. No distension. I'm gonna go ahead and listen to her bowel sounds. We're gonna start with right lower quadrant. And you can do this for up to 5 minutes if you can't hear anything. Okay. Bowel sounds heard in all 4 quadrants. I'm gonna go ahead and percuss. Do you feel any pain? Okay, good. Tympanic resonance in all 4 quadrants. I'm gonna go ahead and palpate. Do you have any pain?
No.
Any tenderness? No masses? No lesions? Okay, can you go ahead and take a seat? Close your eyes. You're gonna let me know if you feel an extremity, anything on your body if I do touch you, okay? You feel that? Did you feel that? Did you feel that?
Yes.
Did you feel that?
Yes.
Okay. You can open your eyes now. So her legs, skin is uniform in color. Her skin is warm to touch. Capillary refill is less than 2. Skin colors even is appropriate for her ethnicity. No edema noted, no pitting edema. I'm gonna go ahead and feel for her tibial pulse. And it's evenly distributed to bilateral feet. Fetal pulses +2. Good. So +2 for both feet. Okay, so I'm gonna have you go ahead and copy me. Go ahead and copy me. Copy what I'm doing. Okay, with one finger you're gonna touch your nose. You just copy me. Okay, good. She's smooth and coordinated. I'm gonna have you stand up. I'm gonna have you do the tendon walk. So with this, you're gonna follow me, okay? So you're gonna walk from heel to toe, forward and back, okay? So you're gonna do 1, 2, 3, 4. And turn around. Okay, good. All right, so patient is coordinated and smooth, and now we're gonna do the Romberg test. So you're gonna close your eyes, and we're gonna do this for 20 seconds. All right, so the patient is not moving or she's out of balance. It's negative Romberg test. You can open your eyes now. I'm gonna have you walk back, walk forward, and walk back. Okay, so the patient is moving with a smooth gait. Her arms are swaying freely. Can you take a seat? So I'm gonna use this as a hammer. I don't have a hammer, but I'm gonna use this as a hammer. I'm gonna check her deep tendon reflexes. Let go of your knees. So you would hit it in the middle. And she would move her foot, obviously, with a real hammer. And then your arm. Like this. All right. So she had positive reflexes on both arms and both legs. And that's the end of the physical. I'm gonna go ahead and wash my hands. Do you have any questions?
No.
Okay, great. So that's it.